Gonorrhea is a common sexually transmitted infection STI caused by the bacterium Neisseria gonorrhoeae. It primarily affects the genitals, rectum, and throat, and it can be transmitted through unprotected vaginal, anal, or oral sex with an infected partner. Gonorrhea can also be passed from an infected mother to her baby during childbirth, potentially leading to serious health issues in the newborn. Symptoms: many people with gonorrhea do not experience symptoms, especially women. When symptoms do appear, they typically manifest within 2 to 14 days of exposure. In men, painful urination, burning sensation during urination, discharge from the penis, white, yellow, or green, pain or swelling in one or both testicles, though this is less common. In women, increased vaginal discharge, painful urination, bleeding between periods or after sexual intercourse, abdominal or pelvic pain. Symptoms are often mild and can be mistaken for a urinary tract infection, UTI, or another vaginal infection. Rectal gonorrhea: men and women, anal itching, discharge from the rectum, bleeding or painful bowel movements. Throat gonorrhea: sore throat, pharyngeal infection which may be mild or asymptomatic. Complications: if left untreated, gonorrhea can lead to serious health complications. Pelvic inflammatory disease (PID) in women, which can cause chronic pelvic pain, infertility, or ectopic pregnancy. Epididymitis in men, a painful condition of the testicles that can lead to infertility. Disseminated gonococcal infection (DGI), which occurs when the infection spreads to the bloodstream, leading to joint pain, skin sores, or potentially life-threatening infections like septicemia. When pregnant women, untreated gonorrhea can lead to preterm birth, low birth weight, or infections in the newborn, which could result in blindness if not treated promptly. Diagnosis is typically made through laboratory tests, such as urine test. The sample of urine can help detect the bacteria. Swab test. Samples may be taken from the urethra, vagina, rectum, or throat for more accurate results. Treatment: gonorrhea is treated with antibiotics. However, some strains of antibiotic-resistant gonorrhea have emerged, which can complicate treatment. The current standard treatment is a dual therapy that typically includes ceftriaxone, an injectable antibiotic, azithromycin, an oral antibiotic. It's crucial to complete the full course of antibiotics even if symptoms improve to ensure the infection is completely eradicated. Sexual partners should also be treated to prevent reinfection. Prevention: preventing gonorrhea involves practicing safe sex and reducing risk factors. Condoms: using condoms consistently and correctly during vaginal, anal, or oral sex reduces the risk of contracting gonorrhea. Regular testing: routine STI testing, especially if you have multiple sexual partners, helps detect infections early. Limit number of partners: reducing the number of sexual partners lowers the risk of exposure. Mutual monogamy: being in a long-term, mutually monogamous relationship with a partner who is tested negative for STIs reduces risk. Avoid sexual activity with symptoms: if you or your partner have symptoms of an STI, refrain from sexual activity until you've both been tested and treated. Conclusion: gonorrhea is a treatable but potentially serious infection. Prompt diagnosis, treatment, and practicing safe sex are key to managing and preventing the spread of the infection. If left untreated, it can lead to severe health problems, particularly for women and newborns.